Hello and welcome to the program. I'm Sophie Scott. Coming up, using stem cell therapy to fight spinal injuries. But first, Melbourne researchers have isolated a gene linked to osteoarthritis and say the discovery is likely to lead to new treatments. And it doesn't end there. As Jeff Waters reports, the same gene is implicated in the transmission of pain, raising the prospect for new therapies for chronic pain relief as well.
Ian Begg lives with one of the rarest forms of arthritis, familial digital arthropathy brachydactyly, which has passed down through his family. It forms during early childhood and results in deformed hands and feet.
You learn to live with it and you can do most things. A couple of the family members can't, their hands don't quite close properly and they have a bit of trouble.
Scientists at Melbourne's Murdoch Children's Research Institute first identified and named the disease about a decade ago. Then they identified the gene which caused it and found it wasn't rare at all.
This was the first time that this gene has been associated with arthritis, and we were really excited about that because although these families are rare, arthritis is a really common disease.
So common, in fact, at least 3 million Australians are sufferers. But now the gene's identified, a new therapy may be available over coming years.
We obviously have a lot of work to do before we get to that point.
Down the track, my grandchildren and their children, it'll definitely help them, and that's a big bonus.
And as an added bonus, the gene could also help in the treatment of chronic pain.
This molecule also is very important in terms of pain transmission. We don't know much about it yet, but certainly the pain of arthritis, the molecule may be involved as well. So there are many forms of painful arthritis and other painful chronic conditions such as cancer, and we really don't know the role that this molecule plays.
What is known is that the gene is also important in nerves and could hold the key to stopping pain travelling through the body.
For many young people with serious disabilities, nursing homes are the only place they can find accommodation. 5 years ago, Australia started a project to move young people out of aged care facilities. And while many have found accommodation elsewhere, more than 600 remain in nursing homes. Meredith Griffiths has the story.
Jane Watson's son, Jock, was 20 when he suffered serious brain injuries in a car accident. When he left hospital, his family was shocked to learn the only place he could go was an aged care home.
It's devastating for me, or the family.
She says while the staff care for Jock, they're not trained or equipped for his rehabilitation. And Jane Watson says it's hard for her son not to have companions his own age.
Well, we evidence it regularly when we have Jock home and invite his friends over, and all his brothers are there. And he just forgets himself. He is just normal.
In 2006, the state and federal governments unveiled a 5-year plan to reduce the number of young people in Jock's situation. Then there were just over 1,000 people under 50 in nursing homes. In May this year, less than 400 had been moved into more appropriate accommodation.
It's been a good start, but I guess the program didn't really have enough resources.
The Summer Foundation asked a range of advocacy groups, service providers and state disability services what they thought of the national scheme. It concluded that there needs to be many more types of supported accommodation. Under the program, Jock Watson received funding for rehabilitation and was placed on a waiting list for a brand new youth care facility. In July, his family was told the house will not be built.
Well, disappointment that nothing's happened with the money, after all that time and all the promise.
Funding for this program has now ended, but there's still 600 young people living in nursing homes. Governments, both state and federal, are under pressure to provide more money now.
New taxes are rarely popular, but they can be good for public health. A leading US food policy expert has suggested a 20% tax on soft drinks could be a key weapon against obesity. Jessica Nairn has more.
Soft drink, soda, fizzy drink or pop. Whatever the name, they have one thing in common.
They're completely empty calories. There's no nutrition that comes with all the calories.
Professor Kelly Brownell is an expert in food policy and obesity at Yale University. He says waistlines are growing in line with a worldwide obsession with sugary drinks.
The research linking soft drink consumption to risk for obesity and diabetes is stronger than it is for any other category of food, even fast food.
He wants US and Australian governments to get tougher on obesity and says a 20% price hike on soft drink is a good place to start.
The economic estimates are that a tax in about the range of a penny per every ounce of sugared beverage would have a significant impact on consumption of those beverages.
Australian experts have applauded his proposal.
They're the kinds of strategies that occur at a population level, and we need population level strategies if we're going to overcome population level problems.
But some psychologists warn the causes of obesity are complex, often sitting parallel to eating disorders and body image concern.
It's a real dilemma because children are getting bigger and the overweight issue is becoming more prevalent, but at the same time, children are also more concerned about their body image and dissatisfied.
The food and grocery industry questions the relevance of the US-based research.
In Australia, the amount of sugar that Australians have consumed has decreased by 20% since the 1970s, at a time when obesity has doubled.
Professor Brownell will spend the next few weeks travelling the country to spread his idea.
Melbourne scientists say they've had some success applying stem cell therapies to spinal problems. In particular, they're using stem cells to help bones fuse more quickly when patients have discs in their necks removed. Kerry Ritchie has more.
After years in a desk job, Kay Owen developed neck pain so severe she could hardly use her right arm.
So for using the mouse, for general tasks at home, picking up a kettle or whatever it might be.
Kay Owen jumped at the chance to be one of a dozen people taking part in a trial run by the Monash Medical Centre. She was operated on exactly a year ago and hasn't been told if she was implanted with stem cells or a placebo.
There are no tags on these stem cells, so it's not like you're going to inherit anything from anyone else. So to me it seemed relatively safe.
Dr Tony Goldschlager is in charge of the trial.
So we removed the disc, and then where that disc was, we put a little cage, a plastic cage with artificial bone, and then in some patients we add a little drop of stem cells, and in other patients we don't.
Dr Goldschlager says stem cells could be an excellent option for patients who face a higher risk of their bones not fusing.
Patients who have medical problems or who smoke, patients who are older.
Kay Owen's progress is being monitored for 2 years.
Early before we'd had the surgery, I've got two little grandsons and I actually dropped one of them, which was awful. He fell out of my arms because you have no strength. So, I'm back to playing with them.
Before stem cells become widely available, the scientists will conduct a trial on several hundred patients.
The federal court has overturned a landmark judgment against a major drug company which was found to have caused a Melbourne man to have a heart attack. The man launched civil action against the company Merck Sharp & Dohme after it voluntarily withdrew the drug Vioxx from sale in 2004. Graham Peterson took Vioxx to treat arthritis and argued the drug had caused his heart attack. He was awarded about $300,000 in compensation, but the drug company appealed and won.
Mr Peterson has rights arising from that judgment. He can elect to ask the High Court to consider that decision.
Around 400 other Australians have signed up for a class action against Vioxx. Merck's parent company paid almost $5 billion in damages to the United States claimants in 2007. Life as a teenager can be tricky enough, but imagine if you fainted every time you felt anxious or stressed. That was exactly what was happening to Megan Anderson. After years of living with the mystery condition, she was finally diagnosed as suffering from psychogenic seizures. But rather than let the illness get the better of her, the 15-year-old decided to take on another challenge in the hope of helping others. This story produced by Corey Hay.
Well, I'm Megan Anderson. I'm 15 years old and I go to Bendigo South East College. And I'm planning to ride 500 laps of the Tom Flood Velodrome to raise money and awareness for mental health.
Right, 10 o'clock on the knocker.
So it's 208 kilometres. It'll take around 8 hours, depending on weather and different things. I've suffered from mental illness called psychogenic seizures for 4 years now. Basically, I'm just out to help people that are suffering with mental illnesses and don't really know where to turn and what to do. Well, basically, it's known as a conversion disorder where my emotional and mental stress gets too much and, it comes out in a physical way where I faint and then sometimes go into a seizure. Depends where it happens, and yeah, like I've gone down a few times in Bendigo, like downtown, and like people aren't as understanding. They don't really get it, or they think it's something else. They don't actually know what it is, and they sort of just say, well, what's she doing? Like, get her out of the way. And it's hard because it affects everything, like everything I do. I was in denial for about 2 weeks. Mum and Dad were happy that it was not epilepsy, but I kind of just wanted to be medicated and it just go away. But yeah, I'm glad now that I've worked through it, but yeah, at the time it was hard knowing that I was almost doing it to myself in a way. The kids are very understanding, especially in my year level. There hasn't, towards me, it's been like I've felt very supported at school by a lot of kids, and I guess at the start there was a bit of stigma involved with teachers, but yeah, I don't know, the kids have been amazing in my year level, so yeah, if I didn't have that, it'd be very hard to be at school and to be around people who you know aren't really sure around you, and I don't think you can really understand what it's like to live with it until you've lived with it.
Let's go, Maggie!
In society these days, it's very easy to like just take drugs and that deals with it, but with something like my condition, I sort of had to face my fears and I had to deal with different things instead of just finding the easy way out. So turning into a positive was hard, but yeah, I've got there.
Yeah, I feel like I've achieved what I set out to do, so it feels amazing. Yeah, good to be over, and yeah, I'm so happy. I'll keep riding, and I don't know, whatever comes next, I'm not sure yet.
And that's all for this edition of the Health Quarter. You can get more health news at the ABC's Health and Wellbeing portal, abc.net.au/health. And we'll have another Health Quarter in a fortnight. Bye for now.